there are types of practices like cardiology, I expect, where most or many of the calls are people who might have chest pain or are going through something, and they might want that sort of warm connection to someone who's going to listen to them and actually do something in that moment. So I know you work a little bit with that in Go Lean as well. So can you tell me a little bit about how that came about and what difference it makes to just have your one or two people front office staff versus having something like Go Lean behind you?
Yeah, so Golean is a staffing company. We use offshore staffing all over the world, but predominantly from the Philippines, just because there are a lot of nurses and medical people. You can't hire 20 people in the US because that's going to bankrupt you. So how do you try to balance all these aspects? So for me, a big part of it was going offshore, you know? So ever since we did that, we keep metrics. We don't ever miss phone calls. It is not hard for me to hire if we start getting more patients, more phone calls, because it doesn't, break the bank. And you're right. I think voice AI is great. But especially in, my practice, if you're calling, you have chest pain, or, you had a friend that just had a heart attack. Now you're concerned about yourself. You want to speak to someone, right? You want to speak to someone. You want that empathetic, compassionate voice that can help you out. And frankly, navigating the medical system is hard with health insurance and, all HMOs, PPOs. Patients don't know all that stuff. And so I think that the initial call should go to a person.